Okay, so one point, it's probably the most well-used and well-studied point is large intestine 4, or it's also called the meeting valleys. So where is the valley in your hand, in your body? So right between the fingers, the first interosseous muscle, between the thumb and the forefinger. If you just sort of look at it, find the tallest point when you look at laterally, and that is your large intestine 4. And you can apply, or 合谷 in Chinese, you can apply direct perpendicular pressure through your thumb. You can feel a really achy point, like a trigger point right there, that radiates almost to the rest of your hand. And this point is extremely helpful for facial pain, head pain, neck pain. But if you are a pregnant woman, I would not press it because it might promote labor. So, so this is a very helpful point for facial pain, especially head and neck pain. Okay, you apply direct pressure. How do you there are some studies on acupressure as well. Again, primarily in women either pregnant. I think there was postmenopausal symptoms, etc., etc. But in any case, when you apply acupressure, probably just steady pressure using your thumb, where you feel a little bit of pain, radiating pain. That's a good intensity, and on and off for about 30 seconds to 60 seconds. And you can do both hands alternating.
I heard that it also helps inflammation, reduce inflammation.
It could. It's one of the most powerful points in the body, and you would not believe there's millions of studies from functional MRI to studies in rabbit looking at their inflammation markers. Most well-studied point is this point. It also has pain reduction properties in the upper part. Okay, you can teach your patient to do that if you like. It's very simple, essentially no risk. Okay, the next point is also very interesting. My mom actually showed me this point, but it also has evidence behind it. It's small intestine 3, or we call it 后溪, the brook behind. So where is the brook behind? It's also in your hand. If you make a fist here, you can see right near the end of your fifth metatarsal, you can see a little bump, right? With a little brook here. In a way, you have a little crease. And at basically where the bump is, at the intersection between your skin, your labrum skin and your posterior palm skin, right here, also the most prominent point. If you press that, you can either do it against the table as you're studying or whatnot. You can do it with both hands. It's also very helpful for this part of your body. If you have pain, from computer or from driving or from studying in the shoulder and neck region and also your occiput, this is a very helpful point. The reason is because it talks to another point near your ankle right here, and together they open up the channels in the back of your body. Okay, so the brook behind, or small intestine 3, you can just do it like that, very simple. Again, I want you to apply direct pressure to the point you feel some gentle ache, between 30 to 60 seconds. You can repeat a few times a day as well. The next one is probably the second most well-studied point in the human body. Again, in the Western world, it's extremely popular. One story about this point, stomach 36, is that during the bird flu season a couple years ago in China, people were going crazy buying needles and moxibustion, which is really heating little elements, to really work on this point here, because this point is thought to have strong immune functions to help you promote and regularize your immune function. But most importantly, it's helpful for abdominal pain and GI complaints, primarily constipation, I think. So post-operatively, for GI patients, it's actually a useful thing. How do you define it? So stomach 36 in Chinese means 3-mile walk. The idea is that in ancient times, soldiers would massage this point on themselves after a long march because it helped them relax and regather strength as well. So you find it by first find your kneecap, you find the inferior edge, and then you find your palm. So one palm width below the inferior edge of your kneecap, and then you find the anterior edge of your tibia, and then one thumb width lateral to that point. You will feel a little bit ache right there. So So that is your stomach 36. That one is a very deep point, so you really have to apply a lot of pressure perpendicular through your thumb, and you can do a little bit gentle massage, but really you need to create a little bit deep ache to have it be effective. So this is a great point too. You can massage your children if you have GI issues. It's really the second most popular point in Chinese medicine at this point. It's very beneficial. Last one I wanted to introduce is sort of a side point, good for insomnia, and in Chinese medicine it says it really cures hysteria. I have issue. I'm not sure if it actually does cure hysteria, but you can. But it's one of those things. So it's called GV20 or Bai Hui. You can think of it as 100 rivers converging together on top of your head. It's really it's the topest of your head. The way to find it is you find the intersection between, if you go from your nose all the way to, which is the center line, right? And then you find your little axis around your ears. You go up and you meet it. You can also feel your fontanelle sutures. There's your suture line. You can feel very achy. If you find the point, it's actually very achy. Yeah, very achy point. Yeah, you can apply a lot of pressure. So it's good for sedation, good for dizziness, disorientation, and headaches. It's also supposed to treat hemorrhoids. I don't know why, but I think it has to do with the fact they're all on the same meridian. In any case, it's a great side point, great for insomnia, and great for agitation. That concludes my talk. Any questions at this point? Thank you very much for your attention. Yes, ma'am. That's a great question. It's also a great question for future research. So these are primarily practice parameters. For all the clinical trials I just quoted above in Germany, they typically offered between 10 to 12 sessions over the course of 4 to 6 weeks. Again, about once or twice per week for a good 6 weeks, really concentrated treatment. And then they measure the effect at 6 months. As you can see in the previous slides, they were still effective at 6 months. So, however, there has been no studies that really look at the time course of pain relief following a concentrated treatment. So what actually happens in clinic is we usually give 10 treatments up front, either once or twice a week, and then we have the patient come back as needed. So I imagine that's what the German study. I think the German study they just said, just do this and we'll check with you later. I don't think there's strict control reporting what happened in these patients. Why they did so well, it could be that since they felt so good, they get a few more treatments, but they were not reported. What's happening in the clinic, again, is that we treat about 10-12 sessions up front, and then we have the patient back every 2 or 3 months or so to check in if they need it. But yes, the benefit can last quite long, but there's no study right now to prove that. That was a great question. The answer is both. There was one paper published in Pain about 2 years ago, just looking at both. They look at inflammatory markers, and they say they see decrease in the markers were associated with pain reduction as well. So yes. Great question. Thank you very much. Yes. So I think you're referring to pragmatic research where they look at patient-reported outcomes. You have all the key players. There's a name for it. I forgot. They're the stakeholders. You have stakeholders give. Yes, it is going. So there's current a few trials funded. One is for irritable bowel syndrome. I think the other one is for constipation. That's an international trial. But yes, composite outcomes and with more patient-weighted outcomes are being considered, and pragmatic trials is one of our priorities in research in acupuncture. Less. The one that I know is acupressure for the treatment of hot flashes in patients suffering from breast cancer. Another one I think is for fatigue. Not as much, but that's a good question. Thank you for your question. Yes, indeed. There are several. The one which I'm involved with is an international organization. It is called Society for Acupuncture Research. If you're interested, I'll tell you more about it. Next year, we're throwing an international conference in China, in Beijing, in the end of May. So we really try to, this time we try to invoke the Pacific Rim. And this year we had a really successful conference in Ann Arbor where we looked at, this gentleman said, the pragmatic research, mechanism research, different type of interventions, and how we can integrate that in 21st century medical care. So thank you. Yeah, that's a great question. Thank you again for your interest. I appreciate it.